Hello, I'm Glenn W. Hunter of Hunter and Beyond LLC, and this is Dr. James George of Excel Physical Therapy and Wellness. And today, what we want to talk to you about is, chronic fatigue syndrome and fibromyalgia, and what that means not just to people, but also how is it treated. So, Dr. George, are you excited about these particular topics?
Well, I want to help people with such chronic health issues.
Mm-hmm.
Yes, I can talk. I can tell you more about what chronic fatigue syndrome is and fibromyalgia. Chronic fatigue syndrome has many multiple factors causing it. Many times people who have had overload of different environmental triggers like toxins and allergies and infections, and it has overloaded their system, and they ended up in having this diagnosis of chronic fatigue syndrome. And what we find is they present with a lot of neurological problems. They present with memory issues, sleeplessness, and they wake up in the morning. They're not refreshed. They are so tired. They're not able to go through the day, not able to perform their day-to-day activities. And fibromyalgia is about more, there's a lot of pain in their body, and they have some similar symptoms to chronic fatigue syndrome, but fibromyalgia, they have multiple pain areas, trigger points, all the four quadrants in their body, and that causes them to have debilitating effect, and they are not able to do their day-to-day activities, and they kind of not able to perform. They wake up in the morning, they are also tired, they have memory issues, they have problems of concentration. Yes.
So there's a lot of, well, frankly, a lot of problems that come with both of those conditions that really affect people's ability to just get through their day. So there's theories that cause chronic fatigue syndrome, and they may range from viral infections that really get it going, or sometimes stress, psychological stress, or other factors could be the cause. What is your opinion?
As I mentioned, that is correct. Yes, there are chronic fatigue syndrome is multifactorial disease caused by psychological problems, as I said, could be environmental toxin, could be multiple infections, and there is a chronic overload on their immune system. And what we also research has found that, especially in functional medicine, there is involvement of endocrinal function, neurological problems are there, and also there is immunological problems. So just addressing one single aspect doesn't cut it for treating the, chronic fatigue syndrome or fibromyalgia. All three of these aspects should be addressed, and that's how it's going to be helped.
Okay. So as you're making a determination, what are some of the physical triggers that you routinely see?
Typically, with people who have fibromyalgia, what they have found is they are deficient in many of the minerals and vitamins, and there is some underlying depression going on. So there is some biochemical changes happening in the brain, especially with chronic fatigue syndrome, because we see a lot of neurological issues with chronic fatigue syndrome. So yes, and as we said, there is an overload of your immune function, overload of your endocrine function, and your neurological systems.
So as you're looking at all these symptoms, what approach involving homeopathy have you seen to have some success in battling these?
Well, homeopathy is a whole person care treatment. We look at the mind and emotions and the physical symptoms. That's why when a patient comes, we actually ask them their mental, emotional, and physical symptoms, and we compile all these symptoms, and there are about more than 2500 remedies in homeopathy. We match those symptoms to the one of those remedies. We give one remedy at a time and help the patient to heal. Homeopathy is a very most research or most used system of medicine all over the world. It is second most used system of medicine in the world. So because it is helping people with a lot of health issues, that it is being used, and there is research backing up homeopathy helping chronic fatigue syndrome and fibromyalgia.
Hmm.